Hi, my name's Tom McFarlane, and I'm an oncology pharmacist. Here are some other questions that I commonly hear from community pharmacists about cancer treatment. A very common question is about alcohol. In general, alcohol is not going to cause a problem with cancer drugs as long as it's taken in moderation. There are a couple of exceptions to this. Procarbazine can cause a disulfiram-type reaction with alcohol, and it may worsen the adverse effects of lomustine. Cancer patients who consume alcohol need to be careful to drink enough water because dehydration can increase the risk of nephrotoxicity with some forms of chemo. Also, patients should be warned that nausea or taste changes may make alcohol unpalatable. I often get asked about phytoestrogens in breast cancer patients. Soy food products appear to be safe for women with a breast cancer diagnosis. Soy products contain phytoestrogens, which are similar in structure to the natural estrogens in the body. Many breast cancers have estrogen receptors which drive cancer growth. However, several observational studies have shown that phytoestrogens in diet do not increase cancer progression or recurrence. Therefore, soy foods can be safely consumed by women with breast cancer. However, the data on soy supplements is less clear, and these should be avoided. Finally, I often hear questions around sexual intercourse during chemotherapy. There are two considerations here. Firstly, women can secrete chemo in the vaginal fluid, so condoms are recommended for a week after using chemotherapy for all patients, regardless of childbearing age. Secondly, it's highly recommended that contraception be used during chemo for people who are of childbearing age. This should be continued for at least a couple of months after chemo is finished. And remember, don't be afraid to contact your local oncology team. We're always happy to answer your questions.